name is Dr. Rick Seguil.
And action. Hey, Jay, this is Kirk again.
Hey everyone, it's Dr. Rick with a Minute Clinic on diet. So I'm plant-based, but I do have a lot of patients that are not plant-based, or they're actually the reverse, keto or paleo. And that's okay. I think we work within the paradigm of the knowledge we have to design a personal program to reverse the diseases that we have. So I just got off the phone with a young consult of mine, and he's actually a warrior, but we still have some work with regards to insulin to do. And insulin is the scourge of the United States. I think we're overeating, honestly. If your doctor doesn't do an insulin level, you need to ask the doctor for an insulin level, fasting and in the morning. I think it's more valuable than an hemoglobin A1C. If you let an insulin level continue high, will eventually lead to elevated hemoglobin A1C, which is prediabetes or diabetes. But if you can stop the insulin from being resistant in the beginning, no prediabetes ever has to be worried about. And I believe that if you lock down insulin resistance, lower triglycerides, increase HDL, you'll actually have lower LDL cholesterol too. A lower LDL cholesterol, lower diabetes risk usually means no heart disease, which is the #1 killer in the United States. And elevated insulin levels, meaning diabetes, prediabetes, is probably the biggest risk factor to get you into a bad way in case you do have COVID or come down with COVID. If you're going to be around the Bartlett area, I still have openings for the lecture I'm giving this February 6th at the Endorphin Effect, and it will be pretty empowering. I'm going to have several different providers, alternative medicine healers, all weighing in on 3 top cases that I'll present and giving our opinions on what we would do each. Behavioral health, acupuncture, exercise physiology, nutrition. I'll put a link down below in case you're interested. Come on by, wear a mask, and come in early if you want to and exercise. But again, wear a mask and wear gloves. So the idea is, what are we going to do? I have a couple of bullet points that I always hit with everybody. They're fine-tuned a little bit. #1, as far as reducing the risk of insulin resistance, is sugar. I mean, you really have to start reading labels. And if you have anything of sugar, and unfortunately a lot of the stuff we have has sugar in it because it tastes so good and it is addictive. So once you get a taste of sugar, so you try it with a dog. If you get a taste of sugar and you have that reaction that you've developed, if you have a plate of sugar or something that's sprinkled with sugar or sweet stuff, then you have a plate of something else, dog chow, the dog's going to pick the sugary stuff because it'll affect any animal the same way. It turns you on and makes you hunt for that, but it also makes you crash because of insulin. So the first thing is to be aware of the sugar content in all the products that you buy and try to eliminate it. If you can, don't buy the product, and that might limit you, at least in the first stages. Be aware of what the sugar content is and steer clear of anything more than 1 to 2 grams. So that's different than carbohydrates, and I'll get to that in a second. So sugar's a no-no, and unfortunately that means that you're going to have to give up some alcohol, give up your candy, give up some sweets, give up some syrup, and probably fructose. So maple syrup is fructose. Fructose essentially is sugar. It's in the form of table sugar, the white stuff, the powder that you're not supposed to spread on everything, and the cream that you'll have on the stuff that you get at Panera Bread, Dunkin' Donuts. Anything that you drizzle on has sugar, and it's for kids. That's why they put it at the checkout counter, because kids can't stop. And then they ask you and you just say, fine, get it. That's what we have in obese country. So don't do it. Unless you want to go ahead and take berberine or metformin or insulin. I mean, you can do that stuff. But if you don't stop, you'll just need more and more insulin. So stop it, be aware of it, try to reduce it. I think we overeat, and everybody being locked down in the last 12 months. If I do my work here, and I do most of my consults virtually, and I have some downtime, I would be very tempted to stop by the kitchen and get something and pass by the cupboard or the fridge or the table and just say, that will probably not hurt. I'll just have a little bit. And you're not supposed to do that. You're supposed to eat 3 times a day, maybe, and that's it, and not eat any snacks in between. But we're Because every time you have a meal, you have to worry about if the meal is triggering insulin. And if it has any bit of carbohydrate or sugar, it will. And sometimes it's hard to avoid carbohydrates. Like in an average Filipino diet, usually rice is a component of every dish. And you have to take the entire dish, which is the glycemic load, and average out the macronutrients and see, is it more protein dominant, is it more fat dominant, is it more carbohydrate dominant. If you lean more into the carbs, you're going to have to spike insulin. That's the way the pancreas works. But if you just load it 3 times a day, breakfast, lunch, and dinner, then at least the spikes can be softened a bit and they won't shoot up so high, especially with high fiber. So there's a lot of other things that go into the components of what you see on your plate, and it changes the dynamics of the entire meal. That's called glycemic load versus the individual components, meaning the glycemic index. So if you look up the glycemic index, or GI, for rice, it'll say, depending on the color of the rice, it'll list it as maybe 5 or 7. And the higher it goes, the faster it gets absorbed. And the faster something gets absorbed, the higher the spike of insulin. So if you can slow down the absorption of that rice or that bread or that grain, then you theoretically can relax the pancreas into not making so much insulin. And that's where the whole meal comes in handy. So if you have a little bit of rice, a lot of protein, a lot of fat, I don't mean animal protein, it can be plant protein. So I'm plant-based protein, and I am proud to say that I'm a plant-based athlete, but sometimes I'll go off the reservation and just try something. Like now I'm trying keto. I did keto before. It really screwed up my gut. And now I'm pushing the envelope because I'm starting to build muscle. So that's the one caveat with being a plant-based athlete, is that if I am in the tune-up phase and build-up phase, I really have to pour on protein, and at like 2 to 2.5 grams per pound. That's a lot of calories. That is a lot of protein. It's safe to do it, but I think that's what the muscle needs at 50 and above, because we are not as good as the young people in utilizing protein. And sometimes when you don't have the protein signal, the muscle won't develop, especially between the workouts. So that's when sometimes a muscle gets broken down for fuel. So it's important to maintain muscle girth and muscle strength. It's important to use muscle, but it's also important to load up protein when appropriate. So during my times when I'm going to lean and get more muscle, I will have to do that. And it's sometimes hard to have that much. I can get it in legumes, beans, seeds, and nuts, but man, is it hard. So without overdoing the total volume, which is the next bit, the scheduled appointments of time to eat are important. So 3 meals a day and no snacking in between, and definitely no snacking after the last meal of the day. It's really important because between meals, if you've mixed your glycemic load properly, between meals your insulin drops. If you have a little candy, even one, a Tootsie Roll, it'll spike the insulin again. And then you wind up having persistent insulin. When you have persistent insulin, you develop insulin resistance. So stop the snacks. You don't need them, even an athlete. Now, I can argue the fact, but I'd have to see exactly what the athlete is doing when they push in 3,000 to 5,000 calories per day because they are practicing or loading up in preseason conditioning. That's fair, but I challenge that athlete, because if you're not competing and you're just thinking that you're athletic and you're going for a CrossFit month of maxing out, fair, but the average working guy or gal doesn't need that much, and there's no excuse for snacking. There's something called carb backloading when you do a little bit more carbohydrate at night, but we'll get to that in a second. But sometimes I'll have patients that do 3 meals a day and they'll backload in the evening to prepare for the next morning, and that's still an insulin spike. So I think average American has way too many calories. So when you're taking in 2,000, that's fair depending on what you do. Nowadays, with everybody sitting, you don't need that much. Certainly digestion, hormones, and brain tissue need stuff. But if you're not exercising, no. I think if you're going to put in more calories, then you have to put in the exercise. Sorry, you just have to do it. Those of you who are not using muscle, that is so wrong. And that's why I'm going to talk about that in number 5. But if you're not exercising because you have an injury, get somebody to design a program around the injury. That doesn't excuse you from that. Well, I even have a multiple sclerosis patient. It could be Lyme, but it could be multiple sclerosis that wants to exercise. So he's coming to see me or one of my coaches to figure out a program. That is a warrior before I even give him this warrior status. So there's no excuse. You have to move. Even if you go outside and you take a backpack with you or you hit a hill like I do at Mount Hoy, you got to do something. So when you do something, you are allowed to take in more volume. When you don't do anything, no. Keep it to maybe 1,500 to 2,000 calories per day in max. And if you don't know what that means, you got to get a nutritionist on your team. And I'll have a nutritionist at the Saturday event. There's camps that are polarized now. So as I alluded to, there's people with a low carb community who practice ketosis. And I think it was initially for kids with seizures. The folks that really followed the keto practice, they have now backed it up with data. And I love the data. And it looks like it's panning out. Sarah Helleberg in Indiana and Finney and Volek, D'Agostino, they're all doing great work with regards to ketos. Bickman, as far as the only data that supports plant-based, low-fat, vegan, yes, that's the only study thus far that has documented reversal of heart disease. So there's an argument for vegan low-fat. It's tough, but it also has to be put on top of a framework of calming practice, group therapy, exercise, yoga. There's also data that's being released and accumulating now with regards to keto. A lot of self-experimenters are doing their thing, and I did it too. I didn't fare very well, but I did it for only a month. And I think that the data cannot be ignored. By the same token, you can't ignore the fact that vegan low-fat also reverses disease and cancer. And then there's the paleo guys or protein-sparing guys, and that's been around for a long time, but they've been quiet in the middle between these two camps arguing all the time. And I think protein is very important. As I mentioned, during times when I'm trying to beef up and get strength, especially in preparation for an ascent, 14,000 feet, I have to be well-versed, not only with legs, but with upper body. So I'll pack on some muscle. And the only way to do that, plant-based, is supplement. So I'll have to supplement with, I don't like whey, but it's the cheapest form of protein powder. And I'll have to do that several times a day, in addition to modifying my volume. So I will only do that during the times that I'm in training. When I'm not in training, take it easy. So that's where macros come in handy. And I can go on and on about the arguments, and there's no argument. Everybody, even fasting. Then there's these guys that are fasting. So you'll have keto guys and paleo guys and vegans, and then you'll have them all fast. And I think all the data is great. It's a little confusing as far as which way you go, but that's what a coach is for. We're supposed to design the best way out for the patient that we see in front of us in the room at the time, not for the general population. So I'm not going to make sweeping comments of what's best for anybody. I'll just say that it depends on the patient. But I can pull the trigger in many different ways, and so can the nutritionists that I use. So underutilized. Think of it this way, and this is how I explained it to Joe. Liver can take care of insulin. The liver is about that big, right? Muscle can take care of glucose and lower insulin. Muscles are like this big. You can fit all your muscles into a huge storage box. You can fit your liver into a container, Tupperware. So huge storage box versus container Tupperware. This muscle can store so much glucose. So the way you get glucose out of the bloodstream, especially after having like 3 liters of Red Bull or a lot of carbs and sugar, is you inject insulin into the bloodstream, and that'll get the glucose out of the bloodstream where it's not as dangerous. But then you're on your way to becoming insulin resistant. Either you stop the sugar and carbohydrate load, or use muscle. This container, storage container full of muscle, can act as a sink to pull all the glucose out of the bloodstream. How? Exercise. So when you exercise, a back door opens up in all of the muscle cells, and it allows the glucose to get pulled immediately out of the bloodstream right into the muscle, thinking that you're in fight or flight and you have to run from tigers. So all the glucose has to go not to the liver, but has to go to the muscle. That lean muscle will utilize and drop your glucose levels, so you don't even need insulin. That's why it's important to do it on a regular basis. Now with Joe, I'm slowly building up, but we'll get there. With youth, you can probably turn on muscle without any delayed onset muscle soreness. With a 59-year-old, if you're not exercising on a regular basis, you 40 and 50-year-olds and 60-year-olds, if you're not exercising on a regular basis, man, is it hard to get going. And then, boy, is it painful, especially my fibromyalgia, older athletes. It's painful because you have to pay. And sometimes that 1 or 2 days of delayed onset muscle soreness, you walk around like John Wayne, or you probably don't know John Wayne, but you walk around like you're hobbling and like this because you're so stiff and you're sore. But you know there's an endpoint to that, because when the muscle gets better, and it does slowly get better day after day, then you're stronger than before and you go hit it again harder and you drop the glucose again. So please utilize muscle on a regular basis. Start with 15 minutes a day. And it doesn't matter what time of the day, as long as the muscle is well tuned with sucking all the glucose out of the bloodstream, it'll do it at any point in time, even with a little burst of activity. It's either that or you can start insulin on injections if you want, but I wouldn't do that. A lot of people will poo-poo the idea about mindful practice because I'm not stressed. And honestly, I think the entire country is stressed. You just watch Facebook, you watch the news, and you'll have little hits of stress every time you hear kidnapping occurred, carjacking occurred, there's a political rally over here, COVID's coming, vaccine, people are dying. Every time you hear that, another thing comes up and the stress response goes up and then drops down. It goes up and drops down. And every time the stress response goes up and drops down, insulin is waved out of the pancreas again. So it's important to calm the stress response. That way you don't have any spikes out of the ordinary. If you don't have any spikes, you're safe. So it's a practice though. You can't just say, I'm going to pull out that breath exercise only when I have panic attack. That's a little bit too late. It's like getting into practicing your first class of martial arts and self-defense in a back alley, the south side of Chicago. Nothing wrong with the south side of Chicago. But if you're going there for the first time and at your first class, that's a little bit of a tough situation to implement something that you didn't learn yet. So try to practice breath exercise, and that too, 2.5 to 5 minutes a day. Exercise 15 minutes a day. I'll put videos on my 15 minutes of hell. I think this breath exercise that Andy Weil taught me way back when is still sticking because it's so easy. Non-denominational. You're done. I mean, I do have other things that I do, and I'll put a link to mindful practice, but find your way or have it designed for you by a behavioral health person. I think this is so underutilized. It's so poo-pooed. Technically, it's poo-poo. But the microbiome, which is the gut, it's the living organisms inside the gut, and they're dependent on fiber, which is why I put a link to macros, because the carnivore guys that only rely on meat and no fiber, I don't agree with that. So the microbiome needs fiber to survive. And the wider the assorted bacteria in the gut, the healthier the other processes are of your body. The microbiome can help conjugate and deconjugate, can help change around short-chain fatty acids. They can help build up a barrier so you don't have autoimmune disease. They can help with calming down the immune system in case you get exposed to COVID. They can help with hormones. So the microbiome is a beautiful thing, and we just don't pay any attention to it. So that's why I think it's important to practice healthiness, meaning you have to have slippery substance, meaning marshmallow root, slippery elm, DGL, fiber. You have to have different forms of fiber. I know I've always pushed psyllium husk and acacia, but I think the more varied your fiber sources, the different bacteria get fed. And there's about 2,000 different bacteria. Then you also have to take probiotics. If you have an issue with digestion, digestive enzymes are fine, but there are tests to prove whether you need them or not. And the probiotics, I wouldn't stick with just one. I would rotate your bacterias. Saccharomyces is a cool one for inflammation, but there's different subspecies of bifido, lacto. There's other forms of probiotics that you can take. And I usually will take one entire bottle and then switch it up every 3 months, because that's usually they're 90 days worth. And if you keep on switching, you'll eventually have a very robust collection of bacteria. And again, you have to feed them. And usually when you have a really good collection of bacteria, they also calm the mind too. So an irritated bacteria turns on the mind, increases inflammation, makes you hungry. a calm bunch of bacteria that are working fine and giving you good sleep. And that's where the mind also comes in handy. It helps you get deeper sleep. This is the blueprint for a healthy body and longevity. So this is just my interpretation of how you can lower your insulin with several different things, but at the same time, you can also ensure, as best as you can, longevity and a long health span. So hopefully this gives you a couple of ideas. If you have any questions, put them down below. Otherwise, I'll see you at the next video.